and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I am joined by Dr. Frinny Polanco Walters, who is a pediatrician and attending physician at Boston Children's Hospital in Boston, Massachusetts, and she is also in the Division of Adolescent and Young Adult Medicine. How are you? Welcome.
Hi, thanks so much for having me. It's such a pleasure to be here with you today, Dr. Fleming.
Of course. So, how does life find you these days?
Overall, good. Really thankful that so far, it's been me and my family have stayed healthy and we haven't had COVID. Even though, my kids are younger and they don't have access to the vaccine right now. But yeah, overall doing good, working and a little tired from all the, the news, honestly, that everything that's going around the world. Is trying to stay positive and trying to just pray because that's the only thing I can do these days for certain things.
This has definitely been a week of current events. And it seems like every day something different and worse happens. But to your point, we can control what we can control and trying to make a difference in our little part of the world. So I definitely think it's important to talk about COVID and adolescence, but I wanted to start a few steps back and learn a little bit about your journey to becoming a pediatrician, and then learn a little bit about why you decided to not just be a pediatrician, but to really focus on underrepresented populations and those that are at highest risk.
Yes, definitely. So I do not remember, but apparently I made the decision to become a pediatrician in high school. And I'm still friends with one of my high school teachers. And she's the one who reminds me, I remember when you used to say you want to be a pediatrician. So the interest comes in high school. And I think it goes back to two main big events that happened in my family. One, my sister delivered one of her children at home, and it was just me and her.
Oh my goodness.
And yeah. So, I was forced to see things and do things that I didn't have any idea with the help of a 911 operator on the other side of the phone. And then the other event is that maybe a few years after that, a niece and a nephew both got diagnosed with serious conditions. One had cancer, one has a heart disease, and had surgery around the same time. I remember being in the hospital and both meeting because they're both hospitalized, but they were allowed to meet. And me thinking, oh my goodness, like children need a lot of help. Like I want to make sure. We saw the doctors actually as heroes at that time. And thankfully they're both alive and doing well. And I said, oh, I want to do that. I want to make families happy. I want to help children grow and have long lives. So, I went into college thinking about, pre-med and all that stuff. And then I just thought the pediatrician is the doctor who cares for kids and makes sure that they save their lives pretty much.
Right.
And in college, I remember sitting in a class. It was Introduction to U.S. Healthcare. And I was sitting there, and one of the slides about in the introductory course said that Latinos in the United States are the most uninsured and underinsured population in the country. And a sense of first embarrassment, because I was one of the few Latinas in the class, then of uncertainty, and then finally this feeling that, oh, I have to do something about this. And without obviously having the language of health policy, health equity, that's when that started.
That's it's interesting. I feel like there's a lot of us who started out wanting to be pediatricians because your kids, when you want to be a doctor, and that's the doctor that you interact with the most. Mm-hmm. And I definitely thought that as a young child when I first decided to be a doctor. And I think probably a pivotal moment in my trajectory is I had a Black female pediatrician in high school. And so I was like, okay, this is possible. That's when you can believe it because you see it, right? But then when I got to med school and I did pediatric rotation, I was like, no, not for me. Let me find a different way. So I am very happy to deliver the babies and give them to you. That is the end of my pediatric role right there. Like I'm done with it. But I think it's very important to your point. Like the children are a very important part of our population and need a lot of care and different kind of care. And, you know, we talk a lot about like children are not little adults, right? They need specialized care. Their care is different. Their issues are different. And their risks are different inside and outside of the hospital, right? And so it's a very important population to focus on. And even thinking about adolescents even as a different population, because their needs are very different as they're evolving into this adulthood and trying to make decisions on their own and trying to figure out what they want to do with the rest of their lives in a you know, in a concrete form, but also dealing with all of, you know, their bodies changing and conflicts at home and dealing with their parents and maybe some other challenges around, you know, housing and instability and food instability and all of that. So very challenging population. And so kind of thinking a little bit more about that and decision making and thinking about the COVID vaccine rollout, because that's very real right now, going back to school. Tell us a little bit about your thoughts as how teenagers are thinking about it or interacting with the vaccine, how parents should be thinking about it for the kids who are now eligible for the vaccine. And now there's clinical trials for those who are under 12, which is even another conversation. So wherever you want to jump into that, just go for it.
Yeah, no, definitely. Such an important topic and so practical to my patient population, because it's a discussion I've been having in the past few months actually, you know, every time I see a patient, because right now it's August, people are getting ready to go to school. So they request physicals all the time. And when we talk about physicals, we also talk about vaccines, regardless, before COVID,
right.
You know, was
exactly.
the case.
It's part of the
so, you know, because the COVID vaccine is something that most of them are eligible. I tend to see 12 to 26 years old. So most of my patients are eligible for the vaccine. And one of the things, you know, I ask them is, I can tell if they got the vaccine in Massachusetts. I can tell whether they got it or not. They've done a great job where I can load the records and see that. And if they haven't, the first question I tell them, I ask is why, how come? I want to make sure it's not an issue of access. I want to make sure it's not an issue of availability, like if the parents working during the time where their clinics are open for this, and to make sure that we get over the barriers that we can get over, right? Some of my adolescent patients, they have a lot of access to social media and their friends and other people and cases that they see. And I have had families, so the parents are vaccinated. And they say, oh yeah, I'm vaccinated. I'm waiting to see what happens. Just because the one for adolescents was just released and approved just recently, I want to make sure that a lot of kids don't get into trouble. Some people talk about the heart inflammation that they hear about it. And I actually do have a patient who developed myocarditis after the first dose of the Pfizer vaccine, which is the only one right now that patients can have if they're between 12 and 18.
Right.
And the other ones, I think Moderna is going to be eligible to provide their vaccine to adolescents soon as well. But, you know, I tell them so far what I've seen and what I've read is that, yeah, it's true. Some patients do develop myocarditis. This is not something that, you know, it's new. This could have happened with other vaccines. And actually, we see it with a lot of viruses. I used to take care of a lot of patients who had some viral illness and then they end up having myocarditis. Thankfully, all the ones that I have seen have been mild. And that one patient that I do have, cardiology is following, just, you know, to be on the safe side, making sure we're monitoring. But all the studies we have done have been completely normal. And initially to a point they go up, you know, but then everything has resolved. The patient doesn't feel short of breath. The patient doesn't feel any chest pain. The patient is back to normal and will be allowed to exercise without any restrictions. So I try to reassure them. And I do tell them, if your child does develop something like that, that's what we're here for, to take care of them and monitor them really closely and to keep you up to date. But the numbers, when you look at it, right now, the benefits outweigh the risk of getting vaccinated versus now, given that the rates of adolescent patients 18 and under who are getting hospitalized because of COVID is rising pretty fast, even in states like Massachusetts. You know, we in our practice, we're using masks. We're still using masks, obviously, indoors, but we have been given the go-ahead to remove our goggles. We don't have to on July 26th. And starting today, August 19th, we have to start wearing them again, because the rates are going up again. Okay. So I try to have a conversation, ask them why, try to figure out if there's anything I can do to help them break, you know, through that barrier. If it's something that they have decided because they don't feel sure about it, I ask them what questions they have that I may be able to answer, or what sources I can give them, whether in their language or some reading, level. And we have the conversation. And I always am really cautious not to convince anyone, because I think I tell them, whenever you feel ready, you're going to go get the vaccine. I just want you to know that I have some information I may give you in case you have questions. I don't want you to put your health at risk just because your questions are not answered. But so far, more and more are getting vaccinated, given that time has gone by and people are doing okay.
Yeah.
Also, they may be seeing that some family members who unfortunately are under 12 or for some reason, can't get vaccinated, they're getting sick.
Yeah. Do you have any advice for, those, I would say like 15 to 18-year-olds who are interested in getting the vaccine, but maybe their parents are apprehensive? What are their options? And like, I don't, I'm with a lot of those things on what the rules are very state dependent, right? On whether teens can act on their own behalf for medical decisions, but just, I guess, general advice, because, since it varies from state to state on what they can actually do.
Yeah, that's very, very, very excellent question, because I think it's something that's also in the minds of some adolescents, and the parents don't feel comfortable. I think that, basically the same thing, asking them to ask their parents what their questions are, making sure we are a resource to those parents, and to talk to them on behalf of their children, and explain, we want them to stay safe, we want to stay healthy. They understand that, and they also want to get vaccinated, making sure we answer their questions. But in the end, that family makes that decision, and we just try our best to answer all their questions. And if there's any data that they want us to put in some sort of way for them to understand, we're happy to give that to them. But just talking to the adolescents, and adolescents know their parents more than I know their parents. So asking them what they think it's important, and empathizing with the parents in that. And because at the end of the day, we both want the same thing, which is to protect their children. Exactly. They want to protect them from possible harm from the vaccine, obviously. We want to protect them from possible harm of the virus. So just trying to get on the same page.
And then, and you mentioned early on, like it's time to go back to school. So a lot of, again, very state dependent on what the rules are, how the going back to school is rolling out, whether they're going back to school full time, if they're doing staggered, classroom settings. Mask wearing in the classroom, of course, is a big button item right now. But any just kind of thoughts or reflections on, again, not telling people what to do, because I don't think that's our role, but the guidance when you're trying to make that decision around, do you send your kid back to school in person? Do you keep them home and do virtual? How do you know when to keep them home? And even I was talking to a friend the other day, kind of that common sense thing about when to keep kids home, regardless of COVID or not. So if your kid has a fever or a cough or a runny nose, that you might want to keep them home, regardless of what we think it is, but just our standard kind of universal precautions about not getting other people sick.
Exactly. I think that, the American Academy of Pediatrics have made it very clear that we should definitely be sending our children to school. There is data already that shows that the emotional burden on patients or children themselves and parents when from 2020, from not going to school and missing out. And I have seen that with my patients as well. The mental health crisis among adolescent patients is sadly really bad right now. And to find a therapist for my patients is really difficult, because the wait lists are just so high. And I think the pandemic had to do a lot with it. They have a lot of pressures from different things that they go through, but I think that the pandemic and staying home definitely is a big one. So, I think they should go to school for sure. But how do we keep them protected in school? Right. Wearing masks. We have seen that there's evidence that shows the mask can definitely help prevent getting the virus. And wearing masks, I know that some people have some concerns about that. But again, I think the benefits outweigh the risk, wearing versus not wearing the mask, and going to school, especially for children 2 to 12 that are not vaccinated. Right. But I think that they should go to school to be with their teachers, to learn directly in one classroom, to be with their friends. A lot of going to school is that, emotional component and social interactions with peers, which is very important during this age. So, and if your child, just like you mentioned, has fever, cold, or any symptoms that you're like, oh, this sounds like a possible symptoms of COVID, which is similar to the symptoms of a common cold. I don't think you'll be punished. In fact, I think organizations, institutions, including my own, are telling us, if you're having symptoms, do not come to work, please, because we're trying to avoid closing schools, closing institutions. So make an appointment with your pediatrician or the closest, hospital to you to get tested. Take that day off. I know it's easy said than done for some parents who that may mean having to take a day off from work. But if you have to, because there's someone symptomatic in your house, you may also, even though you may not have symptoms, have been impacted, whether this is coronavirus or some other virus. And I think that, with a letter from the pediatrician, that should be an excused absence to be valid.
And you touched on one of, there's lots of unintended consequences of the COVID pandemic. One is the mental health crisis with the adolescents, especially, but across the board. We've talked about substance abuse, and that's a huge crisis around the country as well. But also, there seems to be an uptick in STIs or sexually transmitted infections, right, in adolescents as well. So, some of these things are clearly related to the pandemic. Some may or may not be. I think it'll be interesting when we do our historical reflection, right, in a few years and put all these pieces together. But do you want to talk a little bit about those kind of unintended consequences of this past year and things that or advice you would give that population in particular?
Yes, no, definitely. I'm so glad you touched on it, because it's something that is affecting the adolescent population significantly. Everyone nationally, the rates of gonorrhea, chlamydia, and syphilis are going up. Last month, I saw a 17-year-old with neurosyphilis. This is something I learned in medical school. Yes.
It's not funny. For people watching, it's not funny, but that's like something we haven't seen in a long time. Yeah.
Exactly. And a teenager, So to me, that said something. And I said, oh my goodness, if we're seeing, syphilis, I honestly thought that I was never going to see, because of how much work they have put in to eradicate this, illness. But it's an infection. It happens. The rates are going up. So I think, being out of school may have something to do with it. Having more time to be, hanging out, maybe related to that. But regardless, I think we have to do something about it, because it's not new that half of STIs affect patients 15 to 24. Right. 50% of STIs in the US is, among that population. So how do we make sure that we keep them safe? Because they come with, we have antibiotics that can cure those diseases, but I think that, if a lot of times they don't have symptoms, and that's why it's called STIs, instead of STDs, and that can create long-term, for example, infertility in women or people who have, uterus and ovaries.
Right.
So I think it's really important to educate the patients about that. In terms of STIs, one other thing is that predominantly is you mentioned about the mental health illness. There are some studies going on right now, actually, about females with depression and the rates of STIs, because there are some studies that have shown that increased stress increase the risk of developing STIs as well. So if the COVID increased stress, and because you have more stress, now you're making decisions that are not the best decisions and sexually risk behaviors. I'm not sure, but it's definitely something worth looking into. And I'm looking forward to the results of those studies that are undergoing. And it's also important to me because usually Black and Latina females tend to be overburdened of STIs.
Yeah, definitely. That is just amazing. I think we are, like I said, I think we're going to find a lot of more unintended consequences as we look back on this time, and whether, to your point, whether it's from how we've been living in the pandemic, like physically, our decrease in kids have been out of school? Is it in a decrease in reproductive health education? Is it just more high risk behaviors because we've been stressed, dealing with our mental health and that type of thing? So I definitely think that was a great point to bring up, and it'll be interesting to look back and reflect, and hopefully we can make some interventions in real time so it doesn't get any worse. But neurosyphilis, that's amazing. I think part of it is like hoping that we were past that, and that was something of our past, but apparently it's something that we need to be very aware of. And like you said, it can be asymptomatic, so we definitely need education around what the risk factors are, so that we don't have those long-term consequences and sequelae as they get older and end up with things that, like you said, infertility that they wouldn't want to have and otherwise. So with that, I don't want to keep you too long. I know you are busy, but it's kind of we wrap up and conclude. I think this year has taught us a lot about ourselves, as individuals, ourselves as physicians, ourselves as family members and parents. But what are you looking forward to, or what are you hopeful for, that we will learn from this, and that somehow we'll come out on the other side better for in the future?
Yeah, I think that one thing we have learned is how resilient we are. I think that a lot of times we don't give ourselves credit. And unfortunately, we have had a lot of friends, relatives who have passed because of COVID, or have been impacted in some way because of COVID ourselves as well. And just trying to, continue taking the positive out of it, and just take a day at a time. It's not easy. Everyone is feeling this way. If you're feeling that for some way you feel depressed, you feel anxious, you feel like you may not be doing well, a lot of people are feeling that way. But one thing I would say, seek and find a therapist is something that a lot of people don't like to talk about, whether it's stigma related or people make assumptions about you as a professional, or whatever it is. Find the help that you need. We all need help. And I think this is a reminder. We all need help, and it's okay to get that help. When we work together, I think that best things come out. So supporting each other as well, being there for friends, for family, for any relatives, and just make sure that you take care of yourself in order for you to be available to take care of others.
Definitely. Thank you so much. I appreciate all the work that you're doing. I think taking care of adolescent population is extremely important. So I appreciate that you're focusing on them and hoping to see what their barriers are and trying to overcome them. So thank you so much for joining us today, and hopefully we'll get to talk again soon.
Of course, this is my pleasure. Thanks so much for the invitation. And just telling people the COVID vaccine is safe, effective, and it prevents severe illness and even death from adolescent patients. So if you're watching this and you have adolescent children who are eligible to be vaccinated, just go to your state website or call your pediatrician or any local offices.
Thank you. That was a perfect way to end. Thank you so much.
Thank you. Bye-bye.
Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.